Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. It's widely understood that cancer is a genetic disease. However, there's evidence that both environmental and lifestyle factors can have a major impact on a person's risk of developing cancer. Our guest in studio today is Dr. David Cosgrove, a medical oncologist with Compass Oncology, a practice in the U.S. Oncology Network. He specializes in general adult oncology with advanced subspecialty expertise in breast and gastrointestinal cancers. Good afternoon, Dr. Cosgrove.
Good afternoon, Neal.
Thank you for joining us today. You know, cancer research, it seems that it's never going to end. Every few years or so, we hear these huge breakthroughs in research and treatments. Let's talk about some of the latest advances in cancer research from your perspective and your research, and see where we are as it relates to our future in cancer research.
Sure, yeah. Well, I would absolutely agree that cancer research is a seemingly never-ending topic, and it's a series of breakthroughs and a lot of work leading up to that behind the scenes, and then a lot of work to kind of strategize and bring those breakthroughs into our community to deliver to our patients. One of the major areas of interest in cancer research in recent years has been in immunotherapy or immuno-oncology, trying to harness the inherent power of the body's immune system to target and eradicate cancer. It's obviously not a new topic. This has been around for decades, but a lot of advances recently and identification of new ways to manipulate our immune cells to make them re-recognize and re-attack cancer. And we've seen some very dramatic responses even in advanced cancer cases, most specifically in melanoma and certain lung cancers, but even across the board in cancers that have proven difficult to treat in the past. So I think when we look at the clinical trial landscape at the moment, you'll find, a very heavy influence of immunotherapy across a number of cancer types with very encouraging results.
So using the body's own immune system to fight cancer, but as that research is developing and becoming even more able to be implemented into mainstream treatment, what about our environment, our lifestyle, things that aren't necessarily under research and we have to wait for the results? What are the things that we can be doing now that they're basically in our control to fight cancer or prevent it?
Yeah, I think that's the key, right? So I think a lot of the research, a lot of the focus goes on treatment trials, and at that point, people have already established cancers, and it has been developing over usually years inside a person's body. I think it's much harder to kind of develop the moonshot program, if you will, focused on prevention, because it doesn't have the same emotional undertone, doesn't have the same kind of buy-in at a societal level, but it's clearly much more important at an overall health level to try and prevent rather than try and treat once cancer has become established.
Aren't we talking about educating people about preventative measures as early as grade school? Shouldn't that be our focus when it comes to cancer?
Yeah, absolutely. And I think you'll find that a lot of the preventive measures we talk about in cancer are going to be applied across the board in healthcare. It'll be similar messages from our cardiologists, from our endocrine specialists, from the oncology community, because a lot of the themes are very similar in preventing cancer and heart disease and diabetes and other chronic conditions.
Now, you say that these breakthroughs in immunotherapy run across a wide range of cancers. In your research and in your experience, what would you say would be the main cancer that most of the research is being focused on? And is that the direction that we should be going in with that specific type of cancer?
Well, I think when we look at immunotherapy specifically, a lot of the research kind of guides us as oncologists to tumors that are likely to respond so that we get that signal first. Which is why, it can often be what we would consider more unusual cancers. So melanoma has been the poster child for this, but that's because based on laboratory data, that's where we see kind of one of the biggest influences of the immune system. And I think the challenge then is to take that headline breakthrough in a small number of tumor types and try and apply that across the board to the broader population. But that takes time. That's where the work comes in between these big breakthroughs to focus this on a wider variety of tumor types.
What types of steps are taken to strengthen a person's immune system as you try to, I guess, reprogram the cells in a particular subject?
So a lot of times it's adjusting the immune system's recognition capacity. So highlighting that the cancer cell is inherently different to our normal cells and using that difference to let your immune cell take action against it. I think one of the problems is that cancer cells are essentially just our normal cells with very, very subtle changes and mutations, and they often escape that immune recognition and allow that cancer to become established. So it's not like we're fighting a virus or fighting a bacteria that is inherently different to our human cells. It is a big challenge to try and tease out these very, very small differences that will allow the identification of cancer versus normal.
Now, you're an oncologist with Compass Oncology. Compass Oncology, it's a practice here in the U.S. Oncology Network. Is this oncology network dealing exclusively in immunotherapy, or is there other research being conducted within this organization or this network?
No, absolutely not. So immunotherapy is just one piece of our clinical trial network. Still, a lot of our clinical trials are focused on what would be considered more standard chemotherapy or other targeted therapies, looking at these differences in cancer cells and normal cells from a protein perspective and from a drug development perspective. So immunotherapy has garnered a lot of attention recently, but it's certainly by no means the only show in town in terms of how we're trying to treat this disease.
Now, in wrapping up this segment, I'd like to talk about sun exposure. It is one of the factors when we talk about contributing factors to the incidence of cancer. Sun exposure, specifically ultraviolet radiation, contributes to more than 1 million cancer cases a year in the United States. Summer is basically here. What can you offer us in the ways above and beyond just your normal sunscreen that we hear about this time of year and have been for the last 30 years?
Yeah, I agree. It's one of the kind of unheralded risks. I think people don't consider it as much of a risk as other things such as smoking. But many cancers, thankfully, most of them fairly easy to treat with superficial treatments. But there is a subset of sun-related cancers, most typically melanoma, that are very, very dangerous and create a huge public health problem. I think the risks for sun exposure and cancer start again early in life. A lot is related to underlying skin type. So those with fairer skin, those of Northern European descent, they tend to have a greater risk of developing that melanoma process. And it's those kind of blistering, high-intensity sunburns that's the biggest risk factor for developing those. So, we as oncologists, we don't tell people to avoid the sun altogether, but we do tell them to be very, very smart about it and try and avoid that sunburn exposure. So wearing a hat, wearing a T-shirt, avoiding the middle part of the day for sun exposure, and using sunscreen at a very high SPF, especially in those with those fairer skin types.
All right. Some excellent advice. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking with Dr. David Cosgrove, a medical oncologist with Compass Oncology, a practice in the U.S. Oncology Network. Dr. Cosgrove specializes in general adult oncology with advanced subspecialty expertise in breast and gastrointestinal cancers, and is a strong advocate for bringing leading-edge therapies to his patients through clinical trials. And we've been in studio this afternoon discussing some of the latest research in cancer, focusing a lot on immunotherapy, using the body's own immune defenses to combat cancer once it is identified. It's been wonderful having you here with us today, Dr. Cosgrove.
Great to be here.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.